All right, so now we are recording, and this training right here that I'm doing is based on, I guess, feedback. You guys know that you're in this community. This community is meant to give you everything you need to be successful. A lot of you guys are doing great. You're going through the courses, you're going through the material, and you're really following every step by step what's expected for you to be successful in here. I did post probably a few days ago asking, hey, what do you guys want training on? As I built the trainings out for this month, and assessment and intervention just popped up. I do have several questions that I'll be providing you guys, as well as those in the community, a cheat sheet and a guide. This is really going to be just a brief training on just to realize that it doesn't matter how hard a question is or how difficult a question is. If you know the rules and you follow a certain system, that you'll always be successful in pretty much answering the questions, at least narrowing it down to the right one and the plausible one. And what we do in boot camp, and we'll also do it in strategy sessions. I think we have one next Saturday. We have this Saturday strategy session. It's a little tongue tired, but we have that next Saturday where I'll be just going over different strategies that people have found to be successful. I have other coaches that'll be coming in, joining, doing different things. So please, the only thing I ask of you guys is just to read the post, follow through. This community is a lot more easy to navigate, and send me a DM if there's something you're really struggling with, because as I create my material, I pull from the areas that you guys need the most support from. But if I don't hear from you, I have to kind of just pull stuff out and, go through trainings or old stuff, or, poll other people when I want to poll you guys, because, you guys matter. And not saying nobody else matters, but you guys really matter because you've made this investment, you're in this program, and I want to make sure you're successful at it. So assessment before intervention, always, period. That's what I got there, because I need you guys to understand that whenever you're looking at a test question, we were going over several questions this week in boot camp, and some reason our minds are fixed to intervene. I know we're social workers, so we always want to help. So automatically we're thinking help, but we're not realizing that before we help, we need to know what we're helping with and what's happening with that individual so we can move forward. It sounds simple, but when you're in a test question and they're throwing all types of things at you, it can be really difficult to figure out whether you should be assessing or whether you should be intervening. So always just ask yourself, have I assessed? Do I have the information or enough data, enough details to determine how I need to move forward and how I need to intervene? So with this training, we're going to give you some techniques on how to stop choosing correct answers at the wrong time. So basically, when you are answering a question, a lot of times they're right. You guys can answer a question and it absolutely is something that we should be doing. The issue is we shouldn't be doing it right then and there. There's something that we should have been doing first, or that is something that is the next thing to do. And then that might be something that comes along later. So that is what we're going over. So the purpose of this really much is just to help you make sure you're not out of sequence, and that you realize that the ASWB exam is teaching you clinical judgment and is giving you and timing. Those are the two things that are most important. So we're going to go back to the good old basics. I believe in keeping it simple. KISS method, keep it simple, social worker. That's what we're going to do. The social work helping process. This social work helping process, everyone knows it. You write it down. You got the eat apple pie and all these different type of things that you remember, but we don't necessarily use it. So I'm going to let you know how it's simple. Just understanding what takes place in these different stages or phases, it will let you know what you need to do and how you need to answer the question. So we're going to go through a few slides, and then I have some questions for you. Nothing too intense, but I do have extra questions that I'm going to drop in the community later on today for you guys to do. Those are a little bit more challenging. So engagement. This is where you're building rapport, establishing trust, and validating the client. That's it. I didn't say we're assessing. We're not doing anything else. We're just meeting the client where they are and building that connection so we can figure out what we need to do to move forward in the assessment process. How's the client feeling? If they're a little antsy, a little nervous, we haven't built that trust, it's going to be really hard to jump in and just start assessing them and hitting them with a lot of facts and details and questions. All right, so basically the assessment process, this is where you're gathering information, you're clarifying, and you're organizing information to fully understand the problem. This is the information gathering stage. This is where we're going in deep and we're getting all the information so we can figure out what is happening in this client. Is this client in crisis mode? Is this client in a psychosis state? Is this client off their medications? Is this client dealing with something medical, but it looks like it could be mental health related? Like, this is where we're getting all the information. We're doing things such as the mental status examination. We're doing the PHQ-9. We're doing all these different tools and things to really figure out what's happening with this client so we can get a full picture. Then after we have that, we go through the planning phase. That's where you're collaborating with the client and you're setting the goals and figuring out what needs to be done so you can help with the change process and getting them to where they need to be. All right. So we got the engagement, assessment, planning, and then we have the intervention stage. That is where we're putting in the work. So as you can see, when these questions pop up, you got all this stuff that happens first, but we're jumping in, intervening. We're implementing strategies. We're doing motivational interviewing skills and some DBT techniques and CBT and all this stuff. But we haven't even did the engagement, assessment, and planning according to the question of the vignette. So this lets us know we need to slow down and go back and make sure these things are done first. Then we have the evaluation stage. This is pretty much where you're determining whether whatever you did beforehand, whether it's effective or not. So you can do a thing with a client and maybe say, for instance, your client's dealing with anxiety and you're helping them with some techniques and you're doing different things with them. And you're like, this works for all my clients. I'm just going to do this. But maybe it's making this specific client worse. So your intervention that you're utilizing is not effective. So you need to go back and evaluate what's being done or what's different about this situation. That's what's taking place in the evaluation stage. This is where you're changing treatment goals. This is where you're adjusting the type of interventions or the type of tools that you're providing to the client so they can be successful. And then last but not least is the termination stage. That's when we're pretty much ending the professional relationship. But of course, if you guys have done the trainings, you've done the course, you've done boot camp, you know there's a certain way that we terminate. So we're not going to elaborate on that today for the purpose of this training, but make sure that you understand those stages. And just before we move on, I'm talking about engagement. I'm talking about assessing, planning, intervening, evaluation, and termination. But what comes before all of that? What trumps even the engagement and assessment process? What trumps all of this that you would need to do or figure out with a client when you're starting services?
Safety plan.
Consent.
Absolutely. Safety is first and foremost. Safety first, always. Always safety first. And we always assess before we intervene. Those are the two things. If you can write something down on your little notepad when you're in the testing center, you put safety first. Just put safety in big letters across the paper, and then underneath it, put assessment before intervening, and then put first, next, best, most. All right. And then I'm sure you'll be super successful in that process because that is exactly the steps that you need to follow and you need to do in order to be successful with working with clients. All right. Here's a critical exam rule. As we were talking about safety jumps the line. It doesn't matter what happens. It's technically part of the assessment. However, when it comes to ASWB, sometimes safety questions just pop up in there and you're like, wait a minute, she is experiencing this. Maybe I do need to do this. Don't question it. Always address the safety situation or the safety question first. No ifs and buts about it. If there's any indication of suicide ideation, homicide ideation, abuse, neglect, crisis, immediate danger, heightened psychiatric symptoms, stuff going on is just kind of like, we need to address this first. You're going to definitely go in there and make sure you do that safety assessment. All right. So you must assess safety first and foremost. And after that, the exam rule is safety first, assessment, and then everything else follows. So that's pretty much the general rule of thumb for this. All right. So let's talk about why. I'm not going to say you guys because you guys are going to be well equipped. So you're not going to be the ones that miss it. All right. So we're going to talk about why test takers miss questions here. So these are some common mistakes that happen. And this is why people sometimes are not as successful when it comes to passing the exam, because it's the little things I tell you guys that come to bite you in the butt. All right. Number one is skipping engagement when the client's guarded, angry, or silent. We don't even engage. We just jump in and start doing the work. Skipping the planning and jumping from assessment directly into intervention. That's probably the most common one. Because as social workers, we know we got to build that rapport and have some engagement there. So even though it's missed, is not as often missed as the skipping planning and jumping straight to assessment. Skipping the assessment and jumping right into intervention. All right. And the last one is ignoring subtle safety cues that are buried in the question stem. Super, super common. I do one-to-ones and I swear at least I would probably say everyone, but I'm not going to say everyone, but at least every other person, I give them questions and while they're processing it and breaking it down, for some reason, safety is screaming. Well, screaming to me because I just know how to identify it. And I know pretty much certain things that pop up that you know it's safety automatically, but they just bypass it. They're like, this is what's going on. Oh, the client, well, they didn't say they wanted to hurt themselves. They didn't say this. And it's just certain things you have to understand, guys, when it comes to the ASWB exam, it can be hidden and buried down in that question. But if it's anything that's safety related, that's a red flag. You need to address that first. All right. The exam penalizes you when you do things out of order, when you're making a decision that is good, but is not the decision that needs to be made at that current moment. So that is really important. Definitely want to know that. It's not because you guys don't know a thing, because I know you guys are hella smart. You know, all the information, all the content, everything you need to be successful. But for some reason, you skip the order of things. So this is what this training is about. Understand that there's an order and a certain way that you do things. All right. So let's talk about where you are. I have S plus EAPIT. EAPT. So does anybody know what that stands for? S plus EIPT and EAPIT, like what the acronym stands for?
Engagement. I don't know what the
Safety
S is.
first.
Safety first, engagement,
Okay.
assessment,
Oh,
planning,
there you go.
prevention,
Got it.
termination.
Got it. Absolutely. I don't know who said that, but you're going to go back and laugh at yourself when you see it because you're like, wait, I don't know what the S is. Yeah. So the S is
Yeah, that
definitely,
was it.
yeah, that's why it says safety first, S plus. All
Right,
right.
right,
So
right.
it's different things you can do to memorize this. I know people say eat apple pie, but I forgot what the other part is. So I put eat apple pie. It tastes good. That's what I'm just going to think of. It tastes or it's tasty. Whatever I need to do to remember that. And then I'm going to put the S. If you don't want to say safety or remember it for this little acronym, you can say salad. So you eat the salad first. That's supposed to be the healthy and the best thing we do. Then we can eat the apple pie. All right. So whatever it is going to help you remember these things, figure it out, come up with an acronym, write it on your sheet of paper, and use it throughout the test. So the safety gate. If is anyone in immediate risk, this is what you're asking yourself. If so, you conduct a safety assessment immediately. In the engagement phase, is rapport established? If not, you need to validate, acknowledge, you need to build that trust. And then when you're looking at the assessment stage, do I fully understand what the problem is? Like, do I have a gauge on what's really happening? If not, you want to gather data, you want to clarify, you want to explore, you want to get more of the meat so you can figure out what you're going to do with it. All right. The planning gate. Have the goals been agreed upon? So like you need to figure out like, hey, I'm doing this. I need to figure out if this is, the right thing to do or whatever it may be. And when you're intervening, obviously you're creating that goal. You're creating those goals so you can appropriately plan. So when you look at here, we have PI. So you're planning and then you're intervening. But then after that, they normally have the termination stage, but people also, it's evaluation, then termination. So I just put termination in there. But normally you're evaluating what's going on so you can determine whether you need to actually terminate a client or whether the client is ready to be terminated. So that is, let's see. All right, hopefully everybody can still hear me fine. Let me make sure. All right, perfect. All right, so there's a quick exam decision table. This is what I want you guys to look at and kind of understand. So if this to be provided to you as well. So you want to kind of orient yourself with this specific decision-making table so that way it helps you when you're answering the questions and you're kind of maneuvering through the different information. All right, so if a prompt says anything about suicide ideation, homicide ideation, abuse, neglect, immediate danger, crisis, any of that kind of stuff, you're in that safety assessment phase. That is what you're focusing on. So look at this kind of like a buzzword or like a cheat sheet or a guide that when you're doing a question and you're like, I know she said it's easy, we should know this, but this question is really hard. Kind of look at certain things to see if they're in there or not, and that'll let you know where you need to go in the question answering, like what part will come first. All right, if there's an initial meeting or the client's guarded or silent, you're in engagement phase. Same thing. I'm not going to go through that. You guys can see the chart, but your priority, this is what's most important. In the latter part of this chart, if it's a safety issue, immediate risk assessment. Engagement, rapport building, and validation. Assessment, you're gathering data, you're gathering historical information to really learn what's going on with the client so you can develop and go from there. All right, and in the planning phase, that's where you're setting the goals, you're contracting with the client to figure out what's going to be done, how it's going to be handled, and all that good stuff. And then, of course, intervention, you already know all the interventions because that's what we normally jump to first. So make sure you just understand what you should be doing and what should be prioritized. That is the key, what should be prioritized. All right, so let's move on and go from here. So everyone kind of has an understanding about how to utilize this decision-making chart. So what I will do for you guys, and remind me, because I'll get busy and you guys, somebody will remind me, hey, you said you're going to give us that chart or that sheet. Even though it's so much information, there's so much content in that community and in that classroom, it can be overwhelming if you want everything. So just make sure you're just mindful, just using certain tools when you're at that point in your studying routine, and it's going to help you to be utilized in that moment. All right. So final exam takeaway: most wrong answers on the ASWB exam are not unethical or ineffective. They are simply choosing at too early in the game. That's it. So it's not like they're wrong. I read questions all the time, and I'm like, well, you're definitely going to do that. And then it's like, okay, go back, Ariza, think about it, stick with the rules. You're doing this, but it's something that should have been done before you did that. And always remember, safety may jump the line, assessment builds a foundation, and intervention earns points only when the timing is correct. So a test day rule: find the stage that you're in first and then choose your answer. All right. So I know some of you guys are at work, so you're not going to be able to probably unmute or jump in and kind of answer questions, but as many of you that are able to participate and able to, answer questions and stuff, by all means, please feel free to chime in and answer the next few questions. So we're going to go to number one. If you have a sheet of paper and you're watching the replay, write 1, 2, 3. 3, 4, 5, because there's only 5 questions. Write down the 5 questions and then just write down your answer choices, and I'll share the answers at the end, and we'll talk about any of them that you might have found difficult or didn't make sense or didn't flow. Again, when I do these trainings and they're like short and sweet because they're right in the midday, I'm not giving you anything that's going to cause your brain to hurt. That's what I'm going to give you later on today, because I definitely want you guys to be prepared for any type of question that you can come across in that exam. I don't want you guys blindsided when it comes to the exam. So I've heard pretty much the challenge level of questions, so that's why I kind of make them a little bit more harder when I drop them in the community. But definitely make sure that for these 5, you just write down 1 through 5, and we're going to take it a little bit easier here with the question, with the answering. All right, so I will read the scenarios. All right, so a 35-year-old woman is referred to a clinical social worker by her primary care physician due to uncontrolled anxiety and frequent crying spells. This is the first session. The client arrives 10 minutes late. They sit on the edge of their seat and they avoid eye contact. She states, "My doctor thinks I'm crazy, but I just can't sleep because my mind won't stop racing about my job." So automatically we have this scenario. So just think about it for a little bit, because obviously when I switch the screen, you guys are not going to see the questions. So just kind of think about it, jot down some notes, some things that stick out that are most relevant for you, that you think is most relevant for you when it comes to answering the questions. All right, and just be key stuff like 35-year-old, PCP, uncontrolled anxiety, frequent crying spells, late to session, high anxiety. The doctor thinks the doctor thinks she's crazy. Those type of things are the key things that stick out. So let's go ahead and do this question. A client is referred for anxiety and frequently crying. In the first session, she's sitting on the edge of her seat and avoiding eye contact. She says, "My doctor thinks I'm crazy, but I just can't sleep. What should the social worker do first?" So just think about that for a moment and let me know what you're thinking or your answer after we give a few seconds just for others to kind of read through it. A, teach the client a progressive muscle relaxation technique to use to help them calm down before proceeding. B, suggest the client keep a worry journal to track her racing thoughts. C, explore the client's feelings about the doctor's referral. D, develop a contract for the client to attend 6 weekly sessions. So we're going to go on to question number 2. Everybody write down the answer or have any. What are you guys thinking for this one first? I guess I'll ask you guys. We'll show the answers at the end, but what are you guys thinking for this one?
C.
See? All right. So we're going to explore the feelings about the doctor's referral. All right. Okay. All right. Let's go on. So go ahead. Dora, did you want to read this one? Is that why you asked? Number 3?
Yeah, I had to get my microphone situated.
Okay.
After the initial opening, the client begins to share more about her work stress. What is the social worker's primary task during this stage?
Yes,
A, identify the client's maladaptive thought patterns. B, develop a treatment plan with specific and measurable goals. C, gather a history of the client's symptoms and their impact on her life. D, referring the client to a psychiatrist for a medical evaluation. I would say it would be probably C. That would just be me.
C.
A.
I was reading the answers. I said, so what stage? I heard somebody say A. I heard somebody else say C. I was just reading the answer choices. Somebody said C, gathering a history of the client's symptoms and their impact on their life. Somebody said A, identifying the client's maladaptive thought patterns. So I was asking you guys, what stage are they in? Because it says the social worker's primary task during this stage. So what stage?
Initial stage.
Okay, so we're in initial stage. Okay.
So we're doing
right,
that
what
engagement.
Okay. Engagement.
Assessing.
Okay. Okay. Engagement, assessing. Okay. All right. So that is pretty much where you guys feel we are in that moment. All right. And then, so number 2, we got a few people to pick C, a few people to pick A. Anybody else picking anything else?
I said B.
B, developing a treatment plan with specific measurable goals.
I said A.
D is in David.
A as in apple.
Oh, A, yes. I was going to say, yeah, a few people pick A and a few people pick C. I just didn't know if it was another letter that you guys pick. A and C so far. Any other letters?
B as in boy.
Okay, B is in boy. All right, so we got A, B, and C. I don't think anybody's picked D, but A, B, and C. All right, so does anybody want to tell me why they pick A, B, or C? Just, we got a little bit of time here. We're on question number 2, but this one right here, I just really want to make sure you're understanding this and walking away with some knowledge base before we jump in and share the answers. Just kind of telling me what your thought process when you pick A, one person.
For me on C is gathering. So when I see gathering, I'm thinking assessing.
Okay.
Getting more information. And then how is it impacting their life? How is this problem that they're having or this issue impacting?
Got it. Got it. All right. Whoever, anybody pick B, want to share?
That was me. So I'm seeing after the initial opening. So, I mean, I've met this person before, and now they're starting to work work through the stress. So I would get a treatment plan going. I'm like, okay, what can we do to follow through with this?
Okay.
That's how I see it.
Okay. All right. And whoever picked A, does somebody want to go ahead and justify A?
I picked A because I just see that after the initial opening is assessing, and during the assessment, I just think that at this point, the social worker should try to identify the client's thought pattern regarding her work stress.
Okay. Okay. All right. So you think so that's kind of the thought that you're going with that. Okay. Anybody else want to share or agree with them and feel like, oh, that's a good one, or not really sure?
I agree with C,
Okay.
because in the assessment you showed us, it was like gathering, clarifying,
Mm-hmm.
and organizing information to fully
Mhm.
understand.
So without me giving the answer just yet, I appreciate that, Ben. Without me giving the answer just yet, I just want to share that the information in this question, it says after the initial opening, the client begins to share more about her work stress. What is the social worker's primary task during this stage? So it is something going on. We already addressed that we're in the beginning stages. So we're nowhere in the assessment stage, the engagement stage. Several of you are saying you want to identify, which is actually intervening, developing a treatment plan, which is actually intervening, gathering history, which actually is assessing, referring the client to a psychiatrist. We haven't really did a thorough assessment to understand and know that. So I just want you guys to think about that when you're doing your answer choices. Does it align with that? All right, let's move on to question number 3, and I'll give you the answers in a second.
During the assessment, the client mentions that sometimes the pressure is too much. I wish I just wouldn't wake up. What is the social worker's next step? When I think of this, I automatically think, because of her comment, suicide risk. So I'm going to go with the safety, and let me see if there's A, validate the work stress can be overwhelming. B, complete a full suicide risk assessment. C, continue with the biopsychosocial history to see if this is a recurring thought. D, immediately call for the involuntary psychiatric hold. I would go with B.
B.
We lost
All right.
you guys.
All right. So you said B. All right. Anybody else thinking something else? So B is in Bravo is what you're saying. Anybody else picking something else, or everybody's agreeing with B? All right. And B is complete a full suicide risk assessment. All right. Let's go ahead and move on to the next 2 questions, and then we're going to go through the answers, and we'll be wrapping up this training just like that. All right. So let's go on to number 4. A social worker and a client have finished the assessment and have a clear understanding of the anxiety. What must occur before the social worker begins cognitive behavioral therapy techniques? So read through those and let me know which one you're thinking. I'm gonna call on somebody else to see. I know a few of you, if you're at work and you can't jump in, that's fine. But just if you can, you just come off mute and just kind of tell me what answer you picked and why.
Please read the answers. You can't see them.
The social worker must explain the theoretical framework of CBT. The social worker must consult with the referring physician. The client must demonstrate a week of improved sleep. The social worker and client must agree on specific goals for the therapy.
I want to say D, just because I was always taught that if you're doing goals, it should be with the client.
Okay.
I said D too. D.
Who said that? Is that
D.
Carol? Okay. Now I've heard a few people say D as in David. Okay. All right. Any reason that you're picking D? Does it just make
I
the
agree
most
with
sense?
D also, because collaboratively when doing CBT, you work with the client,
Mhm.
working on goals.
Okay. Got
I
it.
think we're in the planning phase right now, so that's why I chose D.
Okay. Intervening in there. Okay. Okay. Now what about, all right, so we're gonna go through all these answers, but let's go through question number 5. I'll read that one out because I realized someone did say they couldn't see it. All right, so number 5 says 4 weeks into treatment, the client reports she is sleeping better, but still feels jittery at work. What should the social worker do to evaluate the current intervention? A, move to a different therapeutic modality since the client is still jittery. B, review the established goals with the client to measure progress. C, terminate services since the primary complaint of sleep has improved. D, tell the client that healing takes time and she should be patient.
I chose B, just to go over to see the progress that she's made and review the established goals.
All right, let me get a few other people to share. Let's see.
I agree with B.
I chose B too.
B is in Bravo. Okay. Why are you guys picking B? So you got to follow Dora's lead though. When she shares it, she tells us why she's sharing it.
After 4 weeks of into treatment, so it's a kind of evaluating it.
Okay. Okay. All right. So you said after 4 weeks of treatment, so you're thinking it's time to review and see the progress being made.
Yes.
Okay. All right. Let's jump into these answers and see. I'm sure everybody got their sheet of paper out with their little, answer key. And here we go. So let's go back. Number 1 was C. Explore the client's feelings about the doctor's referral. Number 2 was C. Gathering a history of the client's symptoms and their impact on their life, on her life. All right. 3 was B, which was complete a full suicide risk assessment. I'm just going back so you can see the questions too, because I'm sure you guys might not remember since we did them at the end. All right. And 4 and 5 was D and B. D, the social worker and the client must agree on specific goals. You're absolutely correct. You're doing something with CBT. You finish the assessment. They have to have a clear understanding of what's going to be taking place in that process and agree to the goals that you're going to be working on. So it's more of a collaborative approach. All right. And number 5, I believe it was B, right? B is in Bravo. Review the established goals with the client to measure progress. You've been seeing them for about 4 weeks right now. So we want to definitely make sure that they understand, that you have an understanding of what's not working and what is working. Now, remember, it's the middle phase of treatment. So the priority is evaluation. You're evaluating outcomes and seeing what's taking place and so forth during that treatment process. Anybody have any questions? Any questions as I go back through this? Did you need me to go back to a question that you did not see?
Well, on number 4, I guess the question just assumes that the client understands what CBT is, and then we go, that's how I'm reading it. Don't we explain what the model is?
The social worker and the client have finished the assessment and have a clear understanding of anxiety. What must occur before the social worker begins CBT? And it would be that the social worker and the client have to agree on specific goals for the therapy. So CBT would be a goal for therapy. So we'll be sharing with them, hey, CBT is a good system or method that we're likely going to be able to help you with, blah, 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 blah. And you're kind of going through that process with the client. Again,
and then we do A. And then we do A after D. We do A after D.
Well,
to explain her.
Hopefully when you're hopefully during that process, you're going to be established. If you want to get technical, I guess you could do that. You would explain the model, but during the main part of this, when you're doing the social work helping process, is to understand that you're supposed to make sure that the client has an understanding of the goals and treatment, but you also have to make sure that's done before you jump into anything else. So to me, when you're going over the specific goals for therapy and the plan, you're probably going to be explaining what CBT is. So it probably would happen at the same time, but we don't want to add extra stuff to it, but you definitely want to make sure before you start, because it says before you begin CBT, that's what we're going to be doing. We're going to make sure that we establish those goals. Were you thinking that the answer was A, that you're going to explain that they're
Yes, I picked A.
Okay.
I picked A. I'm more black and white that way thinking. Yeah.
All right. Did anybody else pick A?
Me too.
Okay. And your thought process the same? Let me see. It looks like a few people put some comments in you guys are putting the answers in the chat. Okay. Never mind. I thought someone had a question in there. Yes. So basically we're going for the purpose of this training and what we went over through all the slides is that we're going through what happens during the different stages of treatment. And it says you have finished the assessment and you have a clear understanding of anxiety. So now before you can start CBT, because we talked about before you can start certain techniques, treatment and all that stuff, you got to have the client have an understanding and agree to it and move forward and know what's going to happen. They collaborate with you, pick the goals and all that stuff. So it's not saying that A isn't a good answer. It just wouldn't be a great answer as it pertains to the overall question that's being asked. So I can see why you guys say explain the theoretical framework of CBT, but I don't really know if you would realistically social workers do that in a therapy session. Like the theoretical framework of CBT is more of a clinical thing that we would have an understanding, but you would let the client know, hey, we have a method, a modality that can kind of help you with your anxiety. Here are some of the specific goals that we work on. This. Do you agree? It's kind of like flows. So I always tell people if an answer doesn't make sense or if you're wrestling between two, just kind of play it out in your head about what that would look like and how it would be done if you were actually in a session to give it some clarity.
I do explain modalities to my clients.
All right. Someone said, someone else was saying something, I think, too.
So
Okay.
basically, A would happen during the assessment process, like objectives and goals, kind of. We already did all that. So we're jumping on to D now, right?
Yeah, it's according to the sentence. The sentence just says you finish the assessment and they have a clear understanding of anxiety. So what happens before you can actually start the CBT technique? Normally, you have to have the client agree because we talked about goal
Uh-huh.
setting and that part during that phase of treatment.
Okay. Thank you.
So if you're looking at it, normally the words, again, I always emphasize this when I do questions, is that you have to think about it. The ASWB was asking you a question or they gave you choices. Of course, that could be, I'm not saying A isn't a good choice, but overall, if we're discussing the stages of treatment and we're talking about the assessment process and what happens after the assessment process, and you you read the training, saw the slides, and kind of saw where we're coming from with that information, you would automatically know that the next part is that we have to get the client to agree with certain goals. And because before we intervene, basically before we do any type of intervention, we have to actually have some goals and some things of how it's going to look in the process. So that's just kind of like the natural progression of things. So I get it. Some of you guys said you're black and white thinking and you see CBT and you're like, oh, I'm going to have to explain the theoretical framework of CBT and break it down and tell them what to expect. I mean, you can, that
So
might
that
be
way,
things, but you're
yeah,
actually,
just so that they agree on the treatment plan because it's collaborative. That's what I'm thinking.
yeah. So that's why D addresses all of it.
Okay. thank
D is
you.
actually says the client must agree on specific goals for the therapy. So you perfect example. You just said A, explain the theoretical framework of CBT, but the client is not collaborating with you. They're not discussing the treatment goals. They're not doing any of that. That's just you doing all the explaining about what the treatment's going to look like. And D is more collaborative. You and the client are working together, discussing those specific goals. And I'm sure in the process, you're educating them on what CBT is because obviously the goals that you're pulling from are CBT. So it's kind of like one of those things you have to think about which answer is the overall best in comparison to all of them that's going to address exactly what the question is stating. So what occurs before the social worker can do that, this would be the stage where you're actually working with the client on creating those goals. So in my mind, it would be, well, I don't want to say in my mind because all of us, think and process it differently, but D to me is going to be going through the stuff that you're saying, but I have a more of a collaborative approach. Me and the client are working together and they're deciding whether these work for them or not and how they're going to proceed.